Have you heard?
In the United States, there's something happening in healthcare. As Americans age at an increasing pace with technology and medicine discovering new treatments to extend our lives, as our caregivers become fewer and the stress of serious illness become more complex, something is changing. Palliative care is a medical specialty focused on providing holistic care to patients and their families of choice in an interdisciplinary model with physicians and advanced practice practitioners, nurses, social workers, counselors, pastoral care, and other disciplines. Designed to meet patients where they are in their illness journey, palliative care seeks to improve quality of life through good symptom management, along with defining the appropriate goals of care from the patient considering their other disease-modifying treatments.
We describe palliative and supportive care as returning the art of healing to the science of curing. What our teams seek is to match the evidence of what research has shown is beneficial with the treatment preference of the patients and their loved ones. You could actually say that we provide the ultimate in personalized or precision medicine. By adding an extra layer of support for patients and families, we're restoring key human elements of care for millions of Americans. My role as the director here at the UAB Center for Palliative and Supportive Care is to really ensure that we're successful in our mission, that we achieve our vision by embracing our core values. Personalized, innovative, expert care, that's what we're about.
Palliative care has increased in U.S. hospitals at a rapid pace and is one of the fastest growing medical specialties. In just 16 years, the percent of acute care hospitals with over 50 beds that have palliative care programs has tripled. In 2016, 1,831, or 75% of these hospitals reported a PC program, which is an increase from 658 in 2000. But have you heard? Access to palliative care in the South lags behind the rest of the country. The last state-by-state report card access to palliative care performed by the Center to Advance Palliative Care revealed that 3 states in the Southeast were among the lowest access to acute care palliative services. But not for much longer.
The Center for Palliative and Supportive Care was established in 1999 as a joint center of expertise between the schools of nursing and medicine. Even though we were one of the first comprehensive palliative care clinical, educational, and research centers in the U.S., we've been one of the Southeast's best-kept secrets. But that's changing. That initial partnership between nursing and medicine has blossomed into interprofessional teams. I feel so fortunate to work with some of the most inspirational palliative care leaders, researchers, and educators in the nation. And we have a singular goal: discovery and dissemination of innovative models that are accessible and acceptable no matter where you live. Simply put, palliative care everywhere. And guess what? We're succeeding.
At the UAB Center for Palliative and Supportive Care, this team has created a nationally recognized program focused on clinical care, education, and research through promoting personalized, innovative, expert care and leadership.
When we say personalized in our approach, what better way to start than in the heart of the communities in which we serve? So in order to advance research and to create evidence-based practice, in our field we use a method called community-based participatory research. It's where academics partner with communities. And then using this partnership method, we reach out to underserved communities. We take the time to establish trust, mostly by truly listening. And then we work in close collaboration with members of the community to develop new culturally based programs. And in this way, we help to spread and scale palliative care across the region.
Another aspect of involving the community requires paying close attention to faith and spirituality. In order to expand palliative care in the South, we have to recognize that ethnicity, spirituality, and religion all influences people's perceptions about serious illness and end of life. By taking these aspects into consideration, we are providing palliative care that meets their needs.
Another aspect of the UAB Center is the emphasis on innovation. Thinking outside of the traditional delivery box and exploring new ways to connect care with patients where they are and in a manner that maximizes quality of life and patient preferences.
We recognize that in order to deliver palliative care and to support patients where they are in their journey, we must creatively develop methods to do just that. Here at UAB, I work with the community-based practice, and we foster ideas, including research and training, to deliver clinical services through home visits, either in person or virtually, by telephone or web-based applications. Our community-based access to palliative expertise, or CAPE program, seeks to do just that, using trained professionals doing visits in homes or other settings, or through providing active telephone nurse coaching through Project Enable. We are on a mission to innovate.
Spreading and scaling palliative care in the Southeast is not an easy task. But while the professionals at the UAB Center for Palliative and Supportive Care are creating ways to personalize and innovate care delivery, that's not enough. Inadequate workforce volumes in the U.S., and especially in the Southeast, coupled with the rural landscape, combine for a unique challenge, which is where expert training comes into play.
Considering that our current workforce pipeline in palliative care will never really be enough to provide direct specialty level care to all of those who need it, we continue to look for creative ways to train more physicians, nurse practitioners, counselors, and other interdisciplinary team members. Through our advanced communication training, or ACT Scholars program, we hope to spread a primary communication skills training into the community of practitioners at local and community levels.
Working with colleagues in other specialties to enhance their skill and comfort with primary palliative care is really paramount. Whether patients have serious illness diagnoses, cancer, heart failure, neurologic disease, or even frailty as a result of aging, our goal is to improve their lives by matching their goals and preferences with what we know about the medical options.
No matter your age, whether you're an elder or a youngster, we're hoping to personalize, innovate, and provide expert level of care for patients and their families. Disease illness burden knows no limits at times, and families and caregivers need us.
Looking ahead for the future, we at UAB are committed to promoting and changing healthcare for the better, no matter at what point our patients and families may enter in their illness journey. And now, through the generous support of a community of committed donors, we announce the launch of the Southeast Institute for Innovation in Palliative and Supportive Care housed at UAB. The primary goal of the Institute is to spread and scale palliative care throughout our region through studying and sharing best practices, innovating care delivery, and training the next generation of providers. We are forging the future of palliative care for the Southeast, and we're looking forward to the many partnerships we will develop. We are ready to grow, we are ready to go.
Coming to a town or home near you, courtesy of the Southeast Institute for Innovation in Palliative and Supportive Care at UAB.